It was a really hard journey for me because what hit me was really unexpected, and I wasn't familiar with the medical services that were around. So having the care coordination helped me work out what I needed to do next as far as my medical care was concerned, and gave me some social support because I was quite isolated. So it was really important to have that go-to person that I could speak to about decision making in my life, and getting them on board, helping me with some of the more practical things when it comes to medical care. I had a GP, I had a couple of psychiatrists, a couple of psychologists, exercise physiologists, so I had also some surgical team as well, so it was basically coordinating the care of all of those. When I wasn't well, it was really hard to deal with these people and try and get what it was that I was what I needed across to these people. So it was really important for me, I guess, to have someone that could help speak up and I guess find out some other avenues for my treatment as well. Having those people to support me throughout that journey just made sure that I was getting the proper medical care, and basically took the anxiety out of trying to get the right treatment for me, so that I could recover probably quicker than what I would have been if I'd been left to my own devices.
Hi, I'm Cheryl Frank, otherwise known as Frankie, and my son is Joseph. And we're here representing the well and unwell depression category in the community. The most important clinical care is derived from the GP and the psychologist available to my son. 90% of the time he operates well. In the 10% of the time he's greatly at risk of suicide, so that's when the services need to be delivered in a timely fashion. In 90% of the cases, Joseph is well managed by his GP and the lovely psychologist that he's developed a great clinical relationship with. When Joseph becomes unwell, it's imperative that our GP is able to access the services that he requires to supplement what he's already doing for Joseph. He has a care plan, and in our experience, the clinical services from the government departments don't coordinate clearly enough with the GP, and I often wonder why the case management isn't actually done in the GP's rooms with my son, a psychiatrist, and the GP, rather than a psychiatrist coming into the home. The services largely have left me out of the planning system and have really dealt with Joseph when he's unwell. Whereas the GP and the psychologist know him well. He's got a well-established relationship with him. My GP's known him since he was 9 years of age, and he's now 30. So really, for me as a carer, I would love to see the system reformed based around what the GPs need. The GP needs to be informed before the patients are discharged from their services. We want to have services delivered by people who know the importance of timely clinical care and clinical assessment, and that at this present point in time is not being delivered.
My name's Delphine, and I do have a lived experience of mental health. However, that's not me, and I don't allow that to define me. The experience that I've had is that there's no one person who has a solution to mental health. It's actually about everyone having a role and working collaboratively together. And unfortunately, there's a lot of people within the system who are protecting their own turf and see other people as a threat to their income. But once the consumer starts to work out what's going on and then takes charge themselves, we can actually draw upon the people that we feel are supportive of us. And it's too much to ask a GP to be wearing so many hats. There's enormous pressure being put on them, and there's simply not the time during the consult. So a lot of them are referring on to psychiatrists and psychologists, which is awesome. However, it's not just with psychiatry, with the medication. It is part of it, but it's not all of it. However, there's also the sense that it comes back to the self. A lot of people are not being encouraged to look at the self of taking their responsibility in it. And it's once you start to take responsibility, once you've come through and healed enough, like that's another step. The coordination is when everyone can start to work complementarily together, collaboratively together, the system will work.